Hello, do you know your risk factors for chronic diseases like type 2 diabetes, high blood pressure, strokes, heart disease, Alzheimer's disease, which is a form of dementia, peripheral vascular disease, and even some cancers? Even if you do have this information, do you know what it means and what to do with this piece of information? That's what's coming up next. Stay tuned. I will see you after the channel intro.
Now for today's 2020 idea to better health, please welcome on stage Dr. Joe.
Hello, welcome back. I'm Dr. Joe of the drjoe.com. Now, if this is your first time on this channel, can I extend a warm welcome to you? This is your home of 2020 ideas to better health. So if you haven't subscribed yet, please do subscribe. So when we talk about risk factors for chronic diseases like hypertension, type 2 diabetes, strokes, heart disease, and even cancers, do you know what we mean? And even if you do you know how to use that information to your advantage? That's what this video is about. I decided to do this video because every time I do a video about risk factors for any particular disease, one or two people usually leave a comment saying, well, you didn't tell us about prevention. Well, in actual fact, the prevention is implied. What do I mean by that? Here's what I mean. Right, before we continue, I just want to say something about the content of this video. This is a generic video about the concept of risk factors. So if you understand fully what the concept of risk factors is all about, then you don't have to continue. But if you're humble enough and you want to learn a little bit more, you might get one or two nuggets from this video. It's not about specifics, although I'm going to give an example. So I just wanted to say this to set your expectations right, okay? So let's continue. Normally, when you visit a website or a blog talking about risk factors for a particular disease, or you watch a video talking about risk factors for a particular disease, that piece of information will be displayed in the form of a list. And then you ask yourself the question, what am I supposed to do with this piece of information? How can you use it to your advantage? So let me illustrate this with an example. I'm going to talk about risk factors for clot in the lungs. Okay, usually it starts off as a clot in the deep veins of the leg, and the clot migrates to the lungs. We call it pulmonary embolism. You don't need to know that big term, but we just call it clot in the lungs. Okay, so what are the risk factors for that? So you'll have things like age. If you're over 40, your risk goes up. If you're big, your BMI. If you're obese, that increases your risk. If you've got the blood clotting gene, there are quite a number of them, but one of them is called factor V Leiden. If you've got that, your risk actually shoots up, especially if you've got the two genes. If you are immobile, so for instance, you're going on a long haul flight, so you hop into the plane from London to Sydney, Australia, that's a long flight. That increases your risk. If you had a fracture of the long bones of the leg and you got your leg wrapped in a plaster cast, that also increases your risk. If you're a lady, you're pregnant, that increases your risk. If you're a lady, you're using the combined oral contraceptive pill, your risk goes up. If you're a lady, you are postmenopausal and you're using hormone replacement therapy, HRT pills, that increases your risk as well. If you've had a previous episode of clot in the lungs or clot in the deep veins of the leg, that also increases your risk. So those are the risk factors for developing clot in the lungs, okay? But let me put this into context in a way that you can digest the information easily. So two scenarios. So you're a lady, you're 43 years of age, you are on the big side, you're pregnant, you've got a factor V Leiden gene, your partner is, you're living in London, but your partner is in Sydney, Australia, and you decided that, well, you want to go visit him, so you hop onto the plane, and during the flight, you were so engrossed in the in-flight entertainment, you didn't move around much, and you didn't drink much, so you're also dehydrated. So you arrive in Sydney, Australia, and you develop chest pains. There's a good chance that you probably have a clot in the lungs. Now, let's compare that to a man who is 30 years of age. He's a big guy, and he also was on the same flight with you. And, he gets to Sydney, Australia. he's fine. So if you compare the two scenarios, you realize that the lady has a higher chance of developing a clot in the lungs compared to the gentleman, because the lady has about 5 to 6 risk factors on the list compared to the gentleman who has just 2. Now, it is not an absolute phenomenon, because some risk factors do carry more weight than others. So for instance, when I was talking about the factor 5 Leiden, if you've got the 2 genes, because if you have the 2 genes, your risk actually shoots up a lot. That carries more weight than some of the other risk factors. But the whole idea is that the more risk factors you have, you should take your chances of developing that disease a lot more seriously compared to somebody who has just a few. And of course, if you've got risk factors that carry a lot of weight, then you're going to have to pay more attention to those risk factors. Right, so the next time you visit a blog or you watch a video talking about risk factors for chronic diseases like hypertension, type 2 diabetes, heart disease, strokes, Alzheimer's disease, or even cancers, what you should do is you take advantage of that information in 2 steps. Step 1 is you make a list of risk factors that actually apply to you as an individual, because not all the risk factors will apply to you. So that's step 1. Step 2 is you split those risk factors that apply to you into 2 groups. You split them up into non-modifiable risk factors and modifiable risk factors. The non-modifiable risk factors are things that you can do very little about. So things like your age, your gender, your ethnicity, your genes, there's not a lot you can do about those risk factors. So those are non-modifiable risk factors, okay? We're not going to worry too much about those ones. The other group, the modifiable risk factors, those are the risk factors that we can do a lot about, because a lot of that has to do with just modifying our lifestyle, adopting and maintaining healthy behaviors. That's all you need to do for the modifiable risk factors. So if you're wondering what are the modifiable risk factors, well, examples of modifiable risk factors will include things like smoking. Of course, we can give up smoking. Being overweight or being obese, well, we can take steps, dietary steps, to reduce our body fat percentage. Physical inactivity, well, even if you're very busy, just get moving. Even if you're very busy and you don't have time for exercise, well, start doing my 4-minute nitric oxide dump exercise routine. It only takes 4 minutes. Do that about 2 to 3 times a day. That way you've ticked the box for physical inactivity. Okay, just get some exercise into your lifestyle. Cholesterol, there are various things you can do to reduce your cholesterol levels. Just reducing your consumption of saturated fat, that will help. Reducing or actually eliminating consumption of trans fats, that's going to help reduce your cholesterol levels. I'm going to do some videos series on cholesterol reduction, but those are just a few things you can do. High blood pressure is a risk factor for any particular chronic disease. Well, you can actually take steps to reduce your blood pressure levels. On this channel, I've got lots of videos relating to blood pressure reduction. High blood pressure can be a risk factor for certain chronic diseases, but there are also risk factors for high blood pressure as well. So if high blood pressure is a risk factor for any chronic disease that you're looking at, well, take steps to reduce your blood pressure. Alcohol intake, well, even if you cannot go teetotal, you can take steps to reduce how much you're drinking per week. Just reduce your alcohol consumption to 1 or 2 days a week. That will go a long way to modifying that risk factor. Salt, if it's high salt intake that is a problem, well, reduce your consumption of salt. You don't have to eliminate salt altogether, but you can actually reduce how much salt you are consuming. Consumption of high omega-6 fatty acids, well, reduce your consumption of omega-6 fatty acids and up your intake of omega-3. That will balance that out. Once you reverse that ratio, things will work out better. That is how you can use the modifiable risk factors to alter the cause of the non-modifiable risk factors. Indeed, that is the concept of epigenetics in the simplified sense as it applies to lifestyle medicine. I know epigenetics is a lot deeper than that. It can be very complicated, but in the simplified sense, epigenetics simply means that your genes may not necessarily determine your destiny any longer, because you can use your knowledge of the modifiable risk factors to alter the cause of the non-modifiable risk factors. By so doing, you actually reduce your risk of developing that chronic disease. So this is how you can use your knowledge of risk factors that you learn from any website or any video to actually prevent any chronic disease like type 2 diabetes, hypertension, heart disease, strokes, Alzheimer's disease, and even cancers. Okay, I hope you got some value from this video. If you did, as usual, give it a thumbs up. Share this video with anybody that you think is going to get some value from it. If you got anything to say, any comments to make, any questions to ask, go ahead and ask below. If you haven't subscribed yet, please do subscribe. That's it. Until next time, well, this is Dr. Joe signing out.